Good morning, everyone. This is your Congressman, Dave Joyce. Welcome to today's telephone town hall. For those of you who are new to this forum, I've been using it to discuss issues that are important to my constituents since I was elected in 2012. However, this past week was the first time I've ever used a telephone town hall to address a public health crisis. This is an unprecedented time for our country and for the state of Ohio. Very important that we continue to take proactive, precautionary steps to limit the spread of the disease and stay informed. This is a time for facts, not fear. Here on the line with me to keep you informed about the coronavirus outbreak and its impact on our seniors are Ms. Ursel McElroy, the Director of Ohio Department of Aging, Ms. Holtzen from the AARP Ohio, Dr. Rita Papas from the Cleveland Clinic, Dr. Douglas Beach from the Western Reserve Area Agency on Aging, and Mr. Matt Reed from the Akron Canton Area Agency on Aging and Disabilities. I want to thank each of you for taking the time to engage on this call and for helping me keep the people of Northeast Ohio better informed. If you wouldn't mind, I'd like to have each of you briefly introduce yourselves, tell our callers what your official position is, and explain what you and your organization are doing to help the people of Ohio during the coronavirus outbreak. If you wouldn't mind, could we go in the order that I introduced you all? Dr. McElroy.
Yes, thank you, Congressman Joyce. This is Ursel McElroy, Director of the Ohio Department of Aging. I have the opportunity to work closely with Governor DeWine, Lieutenant Governor Houston, as a part of the administration's cabinet. Both my colleague, Dr. Acton, and myself have been working around the clock on issues related to COVID-19. My area in particular focuses on older adults, and as you are aware, that is a very high-risk population during this time. And throughout this conversation, I'm hoping to have an opportunity to share with you some of the things that we have put in place around our nursing facilities, our congregate housing settings, in the communities, and for older adults who receive different services from many of our different providers, and just our older population generally. I think it's important to note before I pass this along to my colleagues that here within Ohio, we have 2.8 million older adults, and that pretty much equates to us being the sixth largest population of older adults across the country. So we have kept our eye on this issue as we saw this evolving, and we're increasingly concerned about our older adult population. And so I'm really looking forward to having more discussion here today. Thank you.
Thank you. Ms. Holtzen?
Good morning. I am Holly Holtzen, the State Director for AARP Ohio. Thank you for joining, and thank you to the Congressman for bringing us together today. The fundamental purpose of AARP is to empower people to choose how they live as they age. AARP pursues this mission through national, state, and local advocacy, through public education, community outreach, and programs. As a nonprofit, nonpartisan member organization, AARP has been working to promote the health and well-being of older Americans for more than 60 years. So while this disease is new and presents new challenges, this is what we exist to do, not just for the 1.5 million AARP members here in Ohio, but for all Ohioans age 50 plus. AARP is committed to providing information and resources to help older adults and those caring for them protect themselves from the virus and prevent its spread to others. You can find those resources at aarp.org/coronavirus. However you choose to connect with us on our website, on our state Facebook page, or through one of our weekly Thursday teletown halls, you will find a wealth of information related to the coronavirus, family caregiving, and what you can do to stay safe from scams and fraud during this time. I look forward to having this conversation this morning.
Thank you. Dr. Papas, if you will.
Hello, good morning. It's Dr. Rita Papas from Cleveland Clinic. I'm responsible as a physician lead in our Incident Command Center. It's around emergency preparedness for COVID. We've been preparing both on the outpatient side or in the community, as well as how we're going to take care of all the patients who will be sick with COVID or coronavirus. Our team was instrumental in setting up the drive-through testing that's currently available for all high-risk patients.
And doctor, if you will, I understand there was sort of a rush on those outpatient. Can you explain the criteria you're using so everybody knows who should be going to those?
Yes, so what we've instituted within the Cleveland Clinic is an ability to actually conduct testing for patients who are symptomatic, so either have a cough, fever, or feel short of breath, and as well as other high-risk conditions. They have to actually be over 60 or less than 3 and have issues like hypertension or high blood pressure, cancer, or other issues that make them more at risk for the virus.
Oh, thank you. I know there was quite a run there on the first day that you set that up, and I'm glad you're doing that. Dr. Beach from our Western Reserve Area Agency on Aging.
I want to thank you for inviting us. First of all, my son and my brother are physicians. I'm a PhD, so please call me Doug. We want to thank, we want to thank the governor for acting so quickly and so definitively on helping to protect the seniors in the state of Ohio. This is a difficult time. My 5-county area is the largest with respect to seniors in the state of Ohio. For those of you on the phone that have relatives or friends in other areas outside the congressman's area, you will know that there are 650 area agencies on aging statewide or nationwide. One of my colleagues is on the phone today as well. Director McElroy is in charge of the Ohio Department of Aging. There are 57 state units on aging nationwide. So please be assured that you can contact almost any of them, and they'll be able to try to help you through this very, very difficult time. Right now, we do case management for right about 12,000 Ohioans, again, in our 5-county area. And our role, we think, is to help people stay at home, keep them out of hospitals and nursing homes, because other folks are going to need those facilities, and we want to just make sure that we can keep those numbers down. We are trying to assure people, because a lot of our folks right now are at home listening to the TVs and the radios. Many of them are very scared. So we're trying to assure people through the Aging Disability and Resource Centers, which again are statewide, which Director McElroy guides. And so our hope is that through this process, we can keep more seniors at home and do what's in their best interest. Thank you.
Thank you. I think we're all purposed with trying to accommodate that and make sure people feel comfortable and understand what the issues are and how to best avoid them. And Mr. Reed, Matt Reed from the Akron Canton Area Agency and Aging and Disabilities. Welcome.
Thank you, Congressman. My name is Matt Reed. I'm the Senior Vice President of Communications and Administration at Direction Home Akron Canton. We are the area agency on aging just south of Doug's area, covering Summit, Portage, Stark, and Wayne counties. We provide choices for people to live independently in the place they want to call home. And we do that through nutrition programs, elder rights services, wellness education, caregiver support, home care programming, and information and assistance through our Aging and Disability Resource Center, like Doug mentioned. We also are under the direction of Director McElroy and are part of the Aging Network here in Ohio, helping to address older adult needs through a range of supportive services. Currently, we're focusing on access to meals, home-delivered meals, and replacing the congregate meal sites that have shut down. Access to home services. We care manage about 7,200 older adults in our 4-county area, and we are trying to ensure that they have access to the services that are keeping them independent in the community. We're also providing additional access to resources and information around coronavirus and COVID-19 supports through our Aging and Disability Resource Center as well. And I'm very pleased to be on the call. Thank you.
Well, great. Thank you all for taking the time to join me in this telephone town hall to provide information and resources to help our older adults and for those caring for them to protect themselves from the virus and prevent its spread to others. As Ms. McElroy, or Director McElroy pointed out, the fact is Ohio has the 6th largest older adult population in the nation. That population is at a higher risk of serious illness with COVID-19. Together, we will answer some of the questions at the forefront of people's minds when it comes to coronavirus and how it is affecting our seniors, from health impacts to family caregiving needs to what you can do to stay safe from scams and fraud during these unprecedented times. We're also going to do a poll question during the course of this. To give people more the opportunity to join the call and before addressing questions, please take a moment to tell me what your greatest need for information about the coronavirus is right now. Press 1 on your telephone keypad if you want to hear about preparation and prevention efforts. Press 2 if you want to hear more about Medicare and insurance coverage. Press 3 if you want to hear about local resources. And press 4 if you want to hear about supporting loved ones, including family and friends. Again, what is your greatest need for information about this coronavirus right now? Press 1 for preparation and prevention efforts. Press 2 for Medicare and insurance coverage. Press 3 for local resources, and press 4 for support of loved ones. Now it looks like we have enough folks here online, and we might as well get to our experts, get started so they can answer some of the questions you've been asking. Now, Dr. Papas, why don't we begin with you? Can you speak to why older Americans are at a higher risk for the serious illness with coronavirus? And does it mean that turning 65, the age the CDC and other organizations consider the start of older adulthood, automatically puts someone in the high-risk category?
Thanks for the question. We really don't understand why older adults are impacted by this. For some reason, the younger children are not as impacted as heavily. One of the things is the thought is that because older adults have more medical issues like high blood pressure and obesity, as well as chronic lung disease, that's what's possibly making them a more susceptible group.
Well, Director McElroy, can you give callers an update on how the Ohio Department of Aging is helping seniors across the Buckeye State during this unprecedented time?
Absolutely. So we have taken a pretty comprehensive approach, and I'll start with those within nursing facilities because I do believe that's where a lot of the attention came first, and then I'll move through the continuum pretty quickly. So with the nursing facilities, overall, I think it's important to know that we are very concerned about individuals when they congregate or gather together. We know that there is a much easier chance for the transmission of COVID-19 when they are in larger groups. And so being able to minimize contact is very important, at the same time balancing our ability to provide services. So within our nursing facilities, the governor, along with Dr. Acton, our director of the Department of Health, put in place an order that did restrict visitation of nursing facilities. So unless you are an essential worker, such as someone within the healthcare profession that needs to provide a vital service within the facility, pretty much those visits have been limited to those individuals so that we don't have so much of an opportunity for someone to come in and perhaps introduce the virus within the facility. Now, there is an exception to that, people should know, and that is for end-of-life issues. Certainly, there are considerations for that so that loved ones can be around during that time if need be. We also are continuing to monitor the delivery of needed supplies to those facilities and tracking the workforce that they have available to work within those facilities. And we have a special team focused on just this issue within the facilities. Next, I want to move to some of the housing that we have outside of facilities. So we do have large affordable housing communities throughout Ohio where tens of thousands of residents do live and call home. Those places as well are, I think, rife for people congregating and easy transmission. And so we are working with those on-site coordinators to see how we can minimize the ability to congregate, but still make sure that people receive the services that they need, such as meals and personal care. Most recently, there was an order effective to close of business today where our senior centers will close along with our adult day centers. And this is significant because our senior centers across the state provide critical services to older adults. It's not only a location for meals and socialization, but many of them also receive things such as maybe caregiving support or health and education classes. And so what we've done there is to work closely with the senior centers to be sure that these transfers are as seamless as possible, really focused on being sure that those congregate meals are now turned into home delivered meals so no one goes without food. We also want to be sure that we're still checking on these individuals so that the socialization there, which is so important, remains in place. We have another group that was impacted as well by the order, and that are those individuals that attend our adult day centers. In our adult day centers across the state, we have about 4,000 to 5,000 individuals that attend those centers. This is really important because those centers provide hands-on services such as administering medication, providing therapy and personal care, and many of these people require high-level supervision. And so we've put in place a plan to help with that transition and also to be sure that we have the case management services in place to monitor those situations, to be sure that these people still have the things that they need even during this transitional period. And then finally, I think I want to note we're continuing to push information out for anyone who needs it. We're continuing to work with our area agencies on aging and many of our other providers on meal support because we know there may be people who can't get out maybe to get meals maybe in a way that they could before, maybe they're just frightened. And so in that case, we have made it possible to have services such as grocery delivery in certain areas. And again, just making sure that people who need services, whether it be with bathing or medication, that those things are not interrupted. We know that this is a difficult time. This will require us all to pull together, but we are very vigilant about keeping an eye on the people that have high needs, but also being sure that we are prepared and willing to respond to anyone within the community that has questions or needs. Thank you.
Mr. Reed, everyone's heard a lot about social distancing, but I think some people confuse it with quarantine. Can you explain what social distancing is, why it's important, especially for our seniors and those with disabilities, on the underlying health issues and how to actually properly social distance?
Sure. So just a caveat, I'm not a medical expert. I've been working with the area agencies for about 20 years, though, and so I have a little bit of background. But I will say that for this question, I went to the experts and visited coronavirus.ohio.gov. I think that the governor and Dr. Acton and Director McElroy have just done a phenomenal job in providing us resources, like how to answer this question. For this particular one, I also went to the Ohio State University Director of Health Policy. Social distancing is not the same as isolation. Isolation is when someone is known to be infected with the coronavirus and is told to stay away from everyone who's not infected. Quarantine applies when someone has been exposed but is not yet sick. Family members of those who are being isolated for COVID-19 must be quarantined for 14 days. Social distancing really refers to that space around others, the 6 feet of space, as far as I understand it, and the self relying on keeping yourself at home and minimizing exposure to others that are going to prevent the spread of this virus. And I would also pause to see if there are any other experts on the line that might be able to fill in any gaps I missed.
Great. Dr. Papas, I understand we might have disconnected you, that, the telephonic service sometimes.
Sorry about that. I had some technical difficulty. I dialed back in. I'm back on.
Great.
I'm back
I was
on.
just wondering
I'm back.
if you could explain directly what are the symptoms of COVID-19 and explain the difference between its symptoms and those of the flu, allergies, or other illnesses.
Yeah, I think what's very difficult is a lot of the same symptoms that you have with flu and COVID are very similar. The biggest differentiating symptom between flu and COVID is around the runny nose. But both the flu and COVID have fever, cough, and difficulty breathing. In addition, flu has sometimes gastrointestinal symptoms or as diarrhea, and both can have diarrhea, flu and COVID. Allergies tend to just cause runny nose and maybe bloodshot, itchy eyes. What we do know is that initially, within the last 2 weeks, we were actually seeing more flu than COVID. Currently, we're starting to see a slight decline in flu, and we're testing for more COVID. Again, not as much as the flu cases, but we are actually seeing some COVID. We're testing for all three when we get a nasal swab.
Now, as you were distinguishing folks who were coming up just to get tested, there seemed to be some discrepancy between, you want to make sure people didn't have the flu, so they weren't taking a coronavirus test. And so would you say that it would be best if they had a flu test first before they go on to the coronavirus flu or test?
Yeah, so what we were doing was actually making, initially what we were doing is once the patient was swabbed, we were running the test on flu first. If that test came back positive, then we weren't running COVID testing. And then the patient was actually treated with Tamiflu to help with flu symptoms. But currently, since we're seeing a more COVID, what we're doing, we're running the flu and COVID on each of those swabs. So it's one swab that's done, but you get tested for flu A, flu B, and COVID all at the same time.
I see. Doug, can you tell our listeners about some of the precautions that are being taken by the nursing homes and assisted living facilities, to help these people, figure out whether or not there's and prevent the spread of COVID-19 among older Americans who are in that high risk category?
Well, Director McElroy hit some of the high points already. Most of these facilities are preventing people from coming to visit unless necessary. And so that's the first step. They are trying to keep people in their rooms as much as possible and promoting social distancing activities whenever they can. One of the issues that we have in many of these facilities is isolation, and we have it even more at home, trying to overcome isolation, social isolation. So many seniors right now are quite depressed about this. So whatever we can do from a contact perspective, being it aging professionals that are contacting seniors in a facility or at home, be it family and friends that contact them, anybody that can give a senior a call and say hello, how you doing, we think has been a great step forward. But I would follow everything that the Department of Health is talking and Department of Aging is talking about with respect to facilities, and make sure that that's happening in all the every area of your district.
And Congressman, if I may
Go
tag on to Mr. B's comments, this is Ursel McElroy. So he's correct that the facilities are doing what they can. One of the things I will say is that our facilities, they train for this every day. They know how to apply precautions and prevention controls. They know how to bring calm in some of these difficult situations and some of these life decisions. I mean, this is what they do. And the team that I earlier mentioned, we are here to listen to them and learn what we can do to help them and support them as this spread is pretty fast approaching and happening. In terms of how they are operating within the facilities and some of the things they have at their disposal, I mean, what's really important is for them to have personal protective equipment. You'll hear a lot about PPE, so they know when to utilize that. They also have the ability, as mentioned here earlier, I believe by someone on the line, they understand and appreciate when they need to isolate, when they need to quarantine, and when they need to use social distancing. So they are very much aware and appreciative of the three different cohorts that they have to have in place. And finally, in terms of isolation and being separated from family due to not having visitation, many of them have already put in place remote capabilities to where they can either FaceTime or Skype or use the telephone to try to maintain a level of communication. So I know that they have been working really hard to do the best they can with the training and experience they already have in this very different time for us.
Congressman, this is Doug again. If I may jump in there a little bit. We're trying to put together something that we did 20 years ago called telephone reassurance, where we'll have telephone trees to try to reach out to folks not only in facilities but also at home. We think that may be a way to at least get people more integrated in what's going on and help dampen some of their fears, like the director talked about.
Well, that's great. Ms. Holtzen, Ms. Holtzen, I was going to direct one. As the national and state and local officials have increasingly urged Americans to shelter in place, like they've been talking, more and more family caregivers have lost essential caregiving support services. Can you tell us what AARP might be doing or what steps the family caregivers can take to provide the necessary care for their loved ones while taking care of themselves and coping with these new responsibilities and added stress?
Absolutely. So, we know we have 1.5 million caregivers in Ohio, and we expect the virus to increase the number of family caregivers who are providing both short-term and long-term care to their loved ones. Some guidance that we can offer is if you're a caregiver, stay home if you're sick. Practice the social distancing, but remember, social distancing doesn't mean social disconnectedness. At AARP, we are actually in the middle of creating a special website to capture contact information from people who would like to receive a periodic friendly check-in from one of our AARP volunteers. So we're getting ready to launch that. It'll be tested throughout the country over the next week or so. And we have a base of about 11,000 AARP volunteers nationwide who are interested in helping those who would like to receive a daily call. And if you're interested, you can always email us at ohvolunteers@aarp.org. We're also suggesting, if you're a caregiver, have a plan and include a backup plan just in case you or both of you get sick. And put together a list of individuals if you're in your family or friend network or services in your community that can help you perform some of the key caregiver tasks. Make sure you have an inventory of essential items. Make sure you have a 2-week supply of food and medication, basic supplies. Make sure you have your medications and maintain personal safety and care. I think while most of us are very much focused on the person we're caring for, it's really important to make sure you're caring for yourself as well. AARP does offer some resources. Well, go ahead.
So I was just saying that's some great idea. As we realize that no one really planned for this virus, I'm sure a lot of seniors have not taken the time to make emergency plans for themselves, and God forbid both of them get sick. If how do you reach out to those family members or other people to come and help us? That's great stuff.
We offer some caregiving resources at aarp.org/coronavirus, and also our Prepare to Care guide if you want more information.
That's fantastic. And I know that, Mr. Reed, many seniors in Northeast Ohio who live in apartment complexes with shared spaces for laundry and whatnot. What would you recommend that for those in apartment complexes who are trying to practice social distancing and are concerned about using shared spaces?
That's a really good question, and that the answer might be multifaceted. I would say to folks that are living in buildings like that, older adult living, they really should reach out to their building management or their service coordinator that might be on site for options that they have. Older adults and people with disabilities, as well as their caregivers, can always reach their area agency on aging for information and assistance linkage. There might be opportunities for people to help with the laundry service as well, people that maybe aren't in the the over 65 and other areas where they might be more susceptible to this virus, folks can call our Aging and Disability Resource Center at 877-770-5558, or they can reach us at dhad.org, and that's D as in direction, H as in home, A as in aging, D as in disabilities.org. And also, if they do need to do their own laundry or use some of those shared spaces, practicing the safe social distancing, the 6 feet apart, washing hands, things like that can be beneficial for them. And as Director McElroy mentioned, several of the events that were using shared spaces, like congregate meals, are transferring to home delivered meals, and people can reach out to their local area agency on aging for more information about that as well.
And my understanding is they need some help delivering those meals too. If somebody wanted to help and get out of the house and help deliver those meals, is there a place that they can volunteer?
Yes, I'd say if they wanted to reach out to their local 211s to find out more information about local food banks. We also, area agencies on aging also help to manage nutrition programs, and we have providers that are always looking for volunteers, and you can reach out to your area agencies on aging to be linked to those opportunities as well.
For ones who don't know what a 211 agency is, could you explain?
Sure. So in Ohio, you can dial 211, and you have access to the information and referral services in the network. Here in our area, that's through the United Way.
That's fantastic. Dr. Papas, I'd like to pick your brain a little bit more about, I know that there's a lot that's still unknown about COVID-19, but do we know if and how long COVID-19 can live on surfaces like paper, cardboard, or plastic? I've heard from a lot of older constituents who are nervous about picking up their mail or their packages that they get delivered, or even touching the bags their groceries get delivered in. Should they be taking extra precautions when handling these items, such as wearing gloves or wiping them down with disinfectant wipes?
Yes, there's a lot of differing literature on how long that COVID lasts on surfaces. And so what I'd say is once you, for instance, pick up a package from your that's laid outside your doorstep, maybe if you've picked it up, is once you bring it in, it's, as long as you practice good hand washing to continuously wash your hands, or use hand sanitizer, that would be the best effort. The issue with using gloves is twofold. If you use the gloves, then you really should be changing the gloves with everything that you touch, if that makes sense. So, right. Because you could have gloves on that could touch something that's contaminated, and then you would take whatever on your gloves and then continue to spread it through your home. So really what we're advocating is just very good hand hygiene, washing your hands, and when you wash them, to wash them for 20 seconds with soap and water, or be vigilant in terms of using hand sanitizer and not touching your face. That's really one of the biggest things not to do, is not touch your face, because when you touch your face, your eyes, your nose, your mouth, you're actually bringing virus into your immune system.
That's a great point. And you had mentioned before about the testing and all, and you had provided some details on that, what was required to receive the test. Other people may have gotten on since then, so I'm not sure if everybody might have heard what you said at the beginning about the Cleveland Clinic and University Hospitals partnering to provide this drive-through COVID-19 testing patients. Could you again provide more details on that, what is required to receive the test, what people should expect, how long does it take to get the results and all that, and how does the payment work?
Okay, so to step back, so what you need to do is contact your healthcare provider, your primary care physician or nurse practitioner, and once they screen you, and some of the common risk factors, so they're looking for patients who are at high risk, so patients who are greater than the age of 60, or have cancer, dialysis patients, patients with diabetes, high blood pressure, heart disease, or chronic lung disease, as well as patients with HIV or AIDS, or patients who've actually had an organ transplanted. If you meet those criteria of being a high-risk patient and you're sick, so you have to have symptoms. So you have to have either a cough or difficulty breathing or a fever. And a fever is 100.4, greater than 100.4. Once you talk to your primary care provider and they feel that you meet that criteria, then a test is ordered for you. What happens both at the clinic and university hospitals is that a team looks to make sure that you meet that criteria, and then you're actually given a date and time to actually have your drive-through test completed. Since we've instituted dates and times, then the entire process has been flowing much quicker. In drive-through, we ask the patients to come at least 15 minutes ahead of time. It takes about 15 minutes to get through the line. So really, all in all, it's almost a half an hour, I would say, to get your test done. We're working with turning over the test results quickly. Within 1 day, you should be getting your test results. What we're doing at the clinic is activating through MyChart to make sure that the patients receive their results. If your test is sent out to one of the facilities like LabCorp, those test results seem to be lagging just a little bit behind. But technically, so we say most often you would get your test results within 3 to 5 days.
Thank you for that, because in the beginning here we asked a poll question, and could you take a moment and tell us what your greatest need for information about the coronavirus is right now? And the first was about preparation and prevention efforts. 53% of you weighed in on that. Medicare and insurance coverage, 10%. Local resources, 27%, and 10% on supporting loved ones. So I'm glad we're getting out the information to those. And we've got a great panel here for those of you who may have dialed in late. Again, this is Congressman Dave Joyce, and I'm speaking with Director Ursel McElroy from the Director of the Ohio Department of Aging, Ms. Holly Holtzen from the AARP Ohio, Dr. Rita Papas from the Cleveland Clinic, Doug Beach from the Western Reserve Area Agency on Aging, and Matt Reed from the Akron Canton Area on Aging and Disabilities. Mr. Reed, there are countless Ohioans worried about their loved ones in nursing homes and assisted living facilities, which are now unable to visit. How can they stay in touch with their loved ones when they can't be there to support the person like they normally do? And what questions should they be asking if their loved one is in a quarantine facility? Who should they contact also as if they have any concerns?
That is a really good question. Director McElroy mentioned all of the good work that the Ohio Department of Aging is doing, and others as around nursing home prevention and preparation. I did find a really good list on AARP.org about questions that loved ones should ask, and that includes how is the staff cleaning and preparing for the infection? That includes the screening of their employees and how they're sanitizing the facility. The second one is, are regular healthy living programs being maintained? This would be physical therapy, occupational therapy. How are those things being maintained? Third would be the engagement of residents. Are there activities, entertainment and enrichment programming going on? Fourth would be how can you communicate with your loved one? The director mentioned that several facilities are already ramping up the use of technology, and so contacting the facility and asking how they're going to link the resident with their loved ones through that technology can be a really great thing. It's awesome to be living in a time where we can pick up a screen and see our loved one and talk with them. That's really helping. And then finally, how's the facility handling any deliveries if someone's making any sort of drop-offs, or if there are any sort of deliveries being presented? How are those being processed if they are permitted? Also, if people have concerns about the care that their loved one is getting, there is the state long-term ombudsman program, and those are the advocates designated to investigate and facilitate solutions for people that are in nursing homes receiving care. And if folks are interested in reaching their ombudsman, they can reach the Area Agency on Aging and the number that I presented earlier, and we can help direct them.
Well, that's great. I mean, Director McElroy, with the adult daycares and senior centers across the state closed and resources that are being impacted, but people will be more sheltering in place. So what about those living in their own homes? If they need resources like home delivered meals, medical care, who do they contact? Just the other day, a disabled veteran in his 70s who lives by himself asked where he can get assistance because he has no family members to help him get food, and the food bank that he typically goes to has been closed.
Absolutely. So again, as earlier mentioned, they would want to contact their local area agency on aging. There is a statewide number for that, and it sort of routes you to your particular area agency on aging. And that number is 1-866-243-5678. And it will connect you to your area agency on aging, and they are the front line that can help with those meals, etc.
Sometimes it might sound as though we're being repetitive, but people come on and off the line as we're doing this. So I'm glad that you were doing that. And Dr. Papas, getting back to you, I know one of the questions we had are what precautions are being taken by healthcare officials to prevent the spread of COVID-19 in doctors' offices or hospitals between those who come to be tested and treated for COVID-19 and individuals who are there for other health concerns?
Yes, so we are currently what we're doing is anyone who physically would come to a doctor's office or any of our locations, the first thing that happens is actually your temperature is taken. So you're getting a thermal scan to make sure that you don't have a fever, as well as you're given hand sanitizer the moment you enter our facility. So you hand sanitize, you have your temperature taken. If you have a temperature, you're offered a mask, and that you're supposed to mask yourself in order to walk through and be seen. In addition, we're providing protective personal equipment for all of our caregivers who are taking care of patients with COVID-19 in order to prevent the spread from a healthcare worker to another patient. And we have enough supplies to do that without any difficulty. Again, good hand washing and hand sanitizer. We have very good hand washing rates with all of our caregivers. In addition, all of our facilities are being cleaned with our protocols that we've instituted to make sure that we're cleaning on a routine basis in order to prevent the spread in case it actually ends up on beds or poles or whatever other healthcare devices we may have.
Well, one of the things that I've heard mentioned a lot has been the telemedicine. And Ms. Holtzen, last week it was announced that Medicare would immediately expand coverage for telemedicine to plans that didn't already include it. Can you walk our listeners through the benefits of telemedicine and how people can go about using it?
Yes, of course. So if you're able to get onto the Cleveland Clinic website, you can actually link on My Express Care Online. There's directions on how to actually download that information onto your computer, or if you don't have a cell phone, and you're able to actually talk to a provider real time. Like you said, the benefits are taken care of, so you have the ability just to enter the system and ask your questions without having to leave your home. You're seen by a medical professional. They actually can do the same screening that I just talked about, COVID-19, and if they deem that you need the test, they can go ahead and order it for you, and then you'd be given a date and time for your testing to occur. So it's really a great way to actually seek health care from the comfort of your home without having to travel.
So that is a resource that I hope a lot of people use, and because I know going to the doctor's office isn't necessarily the best idea these days. But another thing that people worry about is that those getting their prescriptions, obviously. And so, and feel free, Director, if you want to weigh in on this. What resources are available for local pharmacies to deliver prescriptions to seniors who need their medications, but also need to be staying indoors and self-isolating? I know some seniors have expressed concern about the potential of their doctor's office closing. If that happens, obviously, you could use telemedicine. But what steps should they take to make sure they still have access to health care that they need?
Absolutely. So I would first say, if you have a local pharmacy, I would first start with them by giving them a call to see if this is a delivery service that they do offer. Second, I would say, again, I would absolutely encourage people to call the Area Agency on Aging, because we have a variety of services, and one of those services could absolutely be delivering medications. We are doing things now a little differently, perhaps, than we've had to do them in a while. And so we are working here as a department to extend as much flexibility to our local area agency on aging so they can provide the services people need.
And one of the things that I found that's disturbing is that in any one of these disaster situations, you have people who are trying to prey on our senior citizens. In Ohio, Attorney General Dave Yost has warned that fear and uncertainty surrounding this COVID-19 outbreak has caused an increased number of scams. What can people do, Ms. Holtzen? What information do they need in order to protect themselves? How do they spot scams like this, and what kind of frauds are we aware of today?
Yeah, this is an important issue. So scammers are really doing what they always do. They use headlines as opportunities to steal money or sensitive information. So what we're hearing out there, we're hearing a lot actually. You really need to be wary of people pushing products or stocks that promise a cure. The Federal Trade Commission is a great resource, and the Food and Drug Administration, if you have questions about scams. Additionally, you got to remember, at this time, there is no vaccine, treatment, or cure for COVID-19. Ignore offers online or in stores that claim to offer treatment or cure. We've also heard of reports of scammers in other states going door to door and offering in-home testing for the COVID-19 virus for a fee. This is simply not credible. Please contact your local health department or your physician or hospital. And Dr. Papas went through already on how to get tested. Also, please be on the lookout for requests for donations to help people affected by the coronavirus. Ask the caller to send information by mail and defer that decision once you've had a time to research the charity. You can also call the AARP Fraud Watch Network helpline at 877-908-3360 to report a scam or for help if you think you've become a victim of one as well.
I think it's safe to say, too, during these times, don't give your credit card information over the phone to any organization like that. And take the time to study, like you said, get it through the mail, study. If you really want to do it, make your decision from there. But most of these phone scam callers will never send you anything in the mail.
That's a great reminder. And also,
go ahead.
Remember that when you see suspicious of emails as well, official government entities will have the .gov ending.
Correct. You're absolutely right. That's a great one. The IRS will never contact you unless it's a .gov, and they'll usually do it by the U.S. mail first. Dr. Papas, one of the questions that comes up, it appears that people with diabetes may be at higher risk of getting sick and being hospitalized with this virus because over time, high blood sugar can damage the body's blood vessels, and damaged blood vessels can compromise the individual's lung function, which can make a person more susceptible to serious complications with a respiratory infection like COVID-19. What advice do you have for those practicing social distancing or self-quarantine while also trying to keep their diabetes under control?
That's wonderful advice. Yes, exactly. That you hit on major key points there. So in addition to try to stay healthy, that's a very key part of staying healthy is making sure that your blood sugar is under control, as well as your blood pressure.
But we can't do enough to help out with those folks. It's one last one in either the director or Doug or Matt or whoever got on here. More and more grocery stores are designating specific hours for seniors and other high-risk individuals to shop. Where can people go to find out which stores are offering this, and is it safe for those in that high-risk category to go to the supermarket even during those designated hours?
Well, this is Director McElroy. I will say we are seeing that more and more, and we are appreciative of the industry of recognizing the importance of having a stagger and having those set aside hours for older adults. I would say that it's likely going to vary by area, by grocer. So I would say I would certainly check with your local market to see what those hours are, and to try to stay within those time frames that they have available, because it is going to vary across the state.
Well, I know we're getting to the end, and so I wanted to, our hour is going to be up shortly, but I want to thank all of you. I know all of you took time out of your very busy day to working to keep Ohioans safe from this outbreak to join the call, so I won't take up much more time. To conclude, I'd ask each of you, if you would, to give you the most important takeaways from all the information for our seniors and loved ones about getting COVID-19. And, feel free to chime in here. We could go through order again on our way out.
And Congressman, yes, thank you so much. Again, I want to thank you for this opportunity. This is very important, and we certainly want people to know that under Governor DeWine and Lieutenant Governor John Huston's leadership, we are doing all that we can within the state to keep people safe, and to the extent we're able to make this disruption in our lives right now as easy as possible, right? We don't want people to go out with the basics, and we're going to continue to do the things we need to do that. I also want to be sure that people, I know there was a lot of information given out here today, but it's really important to know that a very trusted resource where we're placing everything in the state of Ohio around coronavirus is www.coronavirus.ohio.gov. Again, that's www.coronavirus.ohio.gov. We have a call center.
Director, do you actually write out Ohio? Is it oh.gov?
I'm sorry, ohio.gov. Thank you.
Okay.
It's actually ohio.gov. And we have a call center as well to answer many of these questions that you may have or things that come up in the future. It's operated every day from 9 a.m. till 8 p.m. And that number is 1-833-427-5634. Again, that's 1-833-427-5634. And for those who like words, that's 1-833-4ASK-ODH. And that line is answered by many of our trusted professionals at the State Department of Health. So you have epidemiologists, you have nurses, you have social workers, you have individuals who are very locked into these issues and can answer your questions in real time. Thank you.
Thank you. Dr. Papas?
Yes, I just want to echo the same sentiments. In Ohio, we are leading the country on what you should be doing in order to prevent COVID. We're very proud of all of the actions that the governor and Dr. Amy Acton have implemented, and we're actually pleased that the number of COVID cases in our state are low compared to other states who haven't acted as quickly as our administration has. And I do believe we were one of the first states to actually put up the ODH hotline for COVID. So again, very glad to be an Ohioan. We should all be very proud.
Yes, I do think the governor's been admirable from the beginning. We wanted to follow his lead and make sure that we all know how to access these resources. And Ms. Holtzen and the AARP has done a great job. Do you have any final words for folks?
Yeah, thank you, Congressman. Like I mentioned before, AARP is committed to providing some information and resources to help older adults in Ohio. Much of our resources are available at aarp.org/coronavirus, and we have links to information about caregiving and how to help you through that, and also fraud and scams through our Fraud Watch network. And, lastly, it is a stressful time for our healthcare professionals and support staff. They also deserve our thanks and encouragement during this time as well.
Yes, as a co-chair of the nursing caucus, I give a shout out for all those hardworking men and women and doctors and all our healthcare professionals for what they're going through every single day. Mr. Reed, quickly, do you have anything?
Just that knowledge is power, and the more folks understand about the resources and availability of supports that will allow them to be as healthy and successful as possible is a great step. Reach out to your local area agency on aging, and we're prepared to answer questions you have and help you navigate through these systems.
Thank you all again for joining me today.
Congressman, this is Doug Beach. I'm back on. Apologize for being on. I just want to pile on with what Matt said. Our Aging Disability Resource Centers are open. Our folks are working from home, but it's like they're at the office with the technology that all of us share. So we are open. We hope for phone calls, and we will try to help as many people as we possibly can and go ahead and figure out a way to decrease some of their fears.
Well, God bless you. Thank you all for joining me today in today's telephone town hall and helping me provide the Ohio's 14th Congressional District with accurate and up-to-date information about the coronavirus outbreak. Thank you to the thousands of constituents who took the time to listen to this important informational discussion. If you still have questions about the outbreak that need answering, the Ohio Department of Health has a call center dedicated to doing just that. It can be reached at 1-833-427-5634. If you have any other concerns you'd like to address, you can contact my office by calling toll-free 440-637-8030 or by visiting www.joyce.house.gov. It remains an honor to represent you in Northeast Ohio here in the United States House of Representatives. God bless you. God bless the United States of America. Stay well out there.